Understanding spondylolisthesis. It is even just really hard to say. So, what is spondylolisthesis? It is basically a slippage of one vertebrae forward relative to the one below. It can be congenital, so it could be a structural defect from birth, or it can be degenerative, so a structural weakening of the bone as we age. And what happens is that forward slippage is graded either 1, 2, 3, or 4, depending on how bad it is. 1 being mild, 4 being really bad. Again, with sort of grades 3 or 4, you may experience some nerve involvement or some nerve impingement. You typically wouldn't expect that with the lower grades. As well as that, the discomfort that someone may experience is probably proportional to the grade of severity. So, grade 1 typically won't have much pain or dysfunction. Grade 3 or 4, you're probably going to experience quite a lot more pain or dysfunction. How is it diagnosed? Only via imaging. So, either an X-ray, a CT, or an MRI is needed to visualize that forward slippage, and then we can measure on those images the degree, give you the grading, and therefore work out what are the best management strategies for you. On the lower grades, conservative management, so you may have some surrounding muscle tightness or lack of mobility. So giving you some exercises or some hands-on treatment to address both of those factors is really important, as well as working on long-term core stability to unload that joint in your lower back and get you feeling better. For the higher categories, it may be exploring surgical intervention to prevent that slippage or to structurally stabilize it, and then therefore work on things like mobility and core stability after that. So I hope that has helped you understand spondylolisthesis. If you have any questions, feel free to reach out.